on, Foxy. It's your birthday. Not for real, just for play. This is Cree Summer, and Moana Nui will be right back.
If this is your first time joining us, you might find that our programming is a little bit different from what you encounter in other rooms in the convention. We are an academic conference that takes place here at the heart of Comic-Con International in San Diego, and also at WonderCon in Anaheim. We have programs that look like this on that table in the back. You'll also find flyers for lots of other exciting things. These programs detail the programming that we've had in this room throughout the convention. We're here every day from 10:30 to 3:30. Also on the back, programs are called papers. If you'd like to present with the CAC in the future, this will tell you how to contact us so that we can tell you how to submit a proposal for future programming. This is our second panel of day 4, and we're all somehow still here. Comics for medical communication. I'm going to turn the microphone over to Gary Ashwal from Booster Shot Media to introduce the rest of this panel.
Okay, hi everybody. Thanks for being here. Our panel is called Comics for Medical Communication. I'm really excited to present the 4 panelists we have here today. My name is Gary Ashwal from Booster Shot Media. We produce patient education comics. So how many of you are familiar with graphic medicine? Okay. So for those of you that don't know, graphic medicine is a field like at the intersection of comics and medicine and health. And there's an organization that does this. There are conferences that have been going on for more than a decade. In this field, a lot of the comics are narratives about illness that use comics as a medium to express those things. They call them graphic biographies. There's also a lot of comics that are about the experience of being a healthcare provider. So from the point of view of a practitioner, kind of explaining some of the things they've gone through or how that fits into their life. We as a panel are doing something a little bit different than that. Our area of graphic medicine is more about using comics in an applied way to achieve a health communication goal in a medical context. So things like patient education, public health, something that has a clinical application. So the panelists that we have today, they're all artists making graphic medicine work, but they all each also have a clinical experience directly with patients in different areas. So I'm going to just read the introduction so you know who they are, and then what we'll do is we'll go through the panels and have questions at the end. So Alex Thomas is a pediatric allergist, immunologist, and a cartoonist with more than 20 years experience. He is the creator of Iggy and the Inhalers, an award-winning comic-based asthma education program that has been translated into 3 languages and has been used by hundreds of clinics and hospitals around the world. Alex is co-founder of Booster Shot Media, a company that educates people of all ages about complex health topics using the power of comics. He is also a founding board member of the Graphic Medicine International Collective. And when not graphic medicine, he continues to see patients in his allergy practice in Chicago. Nathan Gray is a physician specializing in internal medicine and palliative care. He is an assistant professor of medicine at Johns Hopkins University School of Medicine. He's also a comics creator who uses art to promote empathy, educate others, and explore the ironies of the medical world. His work has been published in the Washington Post, the LA Times, the British Medical Journal, the American Medical Association Journal of Ethics, the Annals of Internal Medicine, and others. Nathan's LA Times graphic editorials won both first and fourth place prizes from the California News Publishers Association for editorial cartooning in 2020. Kriota Willberg is a massage therapist, occasional medical illustrator, art and health science educator, and a graphic medicine cartoonist. Plus, she has certificates in bioethics and gerontology. She is the author of Draw Stronger, Self-Care for Cartoonists and Visual Artists. Her Ignatz-nominated comic, Silver Wire, is included in the BCALA and ALA Black Lives Matter reading list. Former artist-in-residence at the New York Academy of Medicine Library. She is now the artist-in-residence in the Humanistic Medicine Department at NYU Grossman School of Medicine and and at the Center to Advance Palliative Care at Mount Sinai. Annika Mengwall has spent her high school years volunteering in her local emergency services, driving ambulances and providing critical patient care as an EMT. She also teaches life-saving techniques as a basic life support instructor for the American Heart Association. Off-duty, she creates interdisciplinary artwork and is currently developing 2 comics, one promoting bystander CPR and the other promoting HPV vaccination. She will be a first year at Yale University this fall, where she plans to study art and prepare for medical school. In the past year, she shared her work at the Graphic Medicine International Conference and on the Graphic Medicine podcast.
All right. Well, thanks for having us. Before I start, I wanted to just remind everyone, or let everyone know that we have a ton of free comics in the back. So if you haven't gone back there, please go, because I need room in my suitcase for stuff. So please take it again. So yeah, as Gary said, my name is Alex. I'm an allergist, immunologist. I'm also a cartoonist. I like to think of myself not as a physician that draws comics, but as a cartoonist who went to med school and became a doctor. So I've been drawing comics since as long as I can remember. And I was interested in health education comics even, as a younger person. So this was a poster in the background that I drew when I was 15 to kind of learn about asthma that I had myself and to help teach other kids about it. So that actually became the first project that Gary and I collaborated on. And we talked a little bit about this, but I'll just run through this quickly. So Icking Inhalers is a comic education program about asthma. And basically what we did was, when I was in my medical training, I realized that there's a lot of not great educational materials that were out there for kids with asthma specifically. And so when I was working in the ER and the ICUs, I was seeing that the same kids were being admitted and readmitted to the hospital, not because they didn't have the right medicine, but they just didn't know the right way to use it. And that confusion went from the kids to the families as well. So I learned in that process that comics have a unique way of being able to teach complex information to kids, and later I realized adults, by using some of the specifics, the language of comics that can be very useful, as well as using ideas like metaphor to create characters that embody, special attributes and lessons that are meant to be learned. So Iggy was a comic book. It was also a multimedia educational program that has lots of different iterations and forms of communication. It's won awards and used in asthma camps nationwide. But I'm most proud of the fact that we have shown that it works, that kids' asthma knowledge improved after the intervention and lingered and lasted longer. And that's something you don't really see in asthma education. Usually kids kind of forget the lessons that they learned, but with this we found that kids retained their knowledge. And my takeaway from that was it was because they were comics. So these are kind of some of the kids in different areas across the country that have been using them. So from this experience, I realized that comics were a really important health communication tool. But I'm still also a working physician, so I struggle daily with kind of a broken system, and really there's not really much time to be able to spend educating the patients I see. And that's not just me, that's doctors across the country. And it's not really our doing. The system is built in a way that you can't really spend the time that you need with the patient, because you have to see such a large volume of patients. So for me, daily was, okay, so if I don't have time that I need to speak to patients in the same depth that I need to, how can I make that limited time the most meaningful? And the conclusion I came to is that comics can help do that. So today I'm going to talk a little bit about how some of these elements of comics can be a useful way to create this deeper understanding of complex medical topics. And I'm going to run through some of the examples that we've done at Booster Shot and how we've applied some of these principles. So just to run through these very quickly, abstraction is a way that you can produce visuals that are easier to identify with and understand. Juxtaposition can add layers of meaning without increasing the cognitive burden to the reader. Metaphor can communicate complex ideas, but intuitively bring knowledge with more simplicity and accuracy. And then sequence can articulate information about time, space, and action in a way that words often can't. So the first example I wanted to run through was something called the stoplight pain scale. And this was a project we did with a pediatric ER doctor in Milwaukee. who did research on pain and found that kids were underreporting their pain when they left the ER for injuries such as like fractures, and their parents were undertreating them for pain. And part of that confusion was that the existing pain scales that are applied were mainly for inpatient use for healthcare providers to be using with their patient. So parents didn't really use the pain scale in a way that was useful because it was just there were too many choices. I don't know if you've ever seen that Likert scale, but it's like a 10-step scale with these kind of gradations of change. For a parent at home trying to know if their kid needs the opioid that they're already scared to give their child, that really wasn't working. So the idea for this project was to simplify, and by using abstraction of smiley faces, create something that was very action-driven. So we had kind of just 3 steps, like a stoplight. So I'm okay, I feel fine, I'm not sure, but ask me again later, and I heard I need something to feel better. And so with the pain scale, we created a comic book that explains how to use the pain scale with 3 different kids experiencing different kinds of pain in different contexts. And so they did some research, a feasibility study on the pain scale, and they found that it was a useful tool for kids aged 4 through 18. So with juxtaposition, this is a project for premature family decisions. So basically, to explain this, this project was a decision tool to help parents and mothers who are pregnant and at risk of having an extremely premature baby. And that means a baby that would be born younger than 24 to 25 weeks, just barely on the verge of viability. So this is where the survival rates are not great and the risk of permanent complications is very high. So obviously this is an incredibly hard decision to make. And so the idea of this tool was to just give families an idea of what the possibilities are depending on what type of choice they made for the birth of this child. So the way that we did this was we used, our researchers helped us, we used the testimonials of actual families who went through these processes, and then they kind of fictionalized some of the details, and we created these stories where we followed several families through the different decisions they made. So in terms of juxtaposition, we had kind of like the decision of 2 different families making 2 different decisions and following them concurrently. So you can kind of see, with Sophia, where they continued care with their child and eventually brought their child home from the NICU, versus Dara, where they withdrew care. And following those families as they went through this decision and went through their lives. Along with the testimonials, we also had professional actors recording voiceovers of these written testimonials, so there was kind of audio along with the visual. So here you see kind of Sophia now after leaving the NICU, dealing with a complex medical child who's on a ventilator, has artificial feeding through a G-tube, whereas in Dara, they are grieving, but now they're kind of moving on with their daily life. And then we also had a couple other families where we went through similar long-term decisions and kind of the consequences of that. So we did a similar project like this that dealt with chronic mechanical ventilation, and they studied that project. And that one, the study showed that it was a novel tool that showed promise for expanding access to balanced, family-centered information about these, really impossible decisions. That the important thing is to give the families the most information that we can to let them make their decisions. So this was an example of metaphor. So this was something for St. Jude's Children's Hospital about CAR T-cell therapy. So first, to explain what CAR T-cells are. So T-cells are immune system cells that are meant to target and destroy abnormal cells. The reason why cancer can be such a deadly problem is that they often can evade T-cells and not be destroyed by them. So chimeric antigen receptors, or CARs, are artificially created receptors that bind to cancer cells better. And so a CAR T-cell is a genetically engineered T-cell that produces these CAR receptors. And now with this ability, they're more able to specifically target and destroy cancer cells. So how do you explain that to a kid and their family when they try to make a difficult medical decision? So that's kind of where the metaphor comes in. So with metaphor, one thing that we learned is that it's important to use existing kind of infrastructure of pop culture concepts. And so for this, we were looking at what technologically advanced characters are out there that kids may recognize or just are in the general zeitgeist of culture. And so that's kind of where we start with, we're thinking of metaphor. And so for an initial concept, one of the ideas is that you're genetically engineering your T cells. So we didn't want families to think that this was like the T cell wasn't any different. It was more just it's the same T cell with added abilities. And so that was the idea where we had this T cell putting on this car suit, like this additional, technological advancement. And so eventually, after kind of a lot of distillations, we came up with this metaphor. So here's an example of the T cell normally working with an abnormal cell where it has these wrapper arms that it's able to grab onto this abnormal cell, whereas with the cancer cell, it's unable to do that. So here we have this genetic engineering process where you have this friendly scientist, which is actually this lentivirus viral vector, that's adding these CAR receptors to the T cell. As you can see, its download mass is kind of like turning more superheroic once it has these abilities. And then with these abilities, the CAR T cell is able to grab onto the tumor cell, and the tumor is scared and destroyed. One other aspect of this is we had to explain how lymphodepleting chemotherapy works. And that's kind of where you need to undergo chemotherapy to clear your immune system prior to a bone marrow transplant so that the CAR T cells are able to successfully reproduce in the body. So we wanted to explain chemotherapy in a way that wasn't confusing but also wasn't scary because it has a lot of kind of baggage with it. So with that, we had this friendly janitor character who was just kind of clearing the way, clearing the riffraff out so the CAR T cells had room to grow. This was something called Forecast for the Future, and this was about sequence. So here, this was a comic book that we made to help explain genomic sequencing results to parents of kids who had developmental issues without a clear diagnosis who underwent genomic sequencing. So it's a very confusing concept, and so part of what we did was create a narrative story of a family going through this process. So here with sequence, we're trying to show kind of how in this busy day of this mom bringing her child to the geneticist's office, that there was a lot going on. So first, in the panel as we're getting ready, she hears that there's a 10% chance of rain, but doesn't bring the umbrella, and then it rains obviously once she leaves. And so then using sequence, we kind of show how quickly the rain came, how she had to run to the bus. And to contrast that, we have her once you get to the waiting room where kind of things slow down, and that's kind of where the stress and anxiety of waiting comes in. And so, visually you can show that just by how you sequence panels. So then, she sees the geneticist and then eventually comes back for a visit to review the results. And on this visit, she hears the weather report, but this time she grabs the umbrella. And then after the end of the appointment, she leaves the clinic, but this time when it starts to rain, she opens the umbrella. So the idea of comparing these sequences was a way of showing, how you may get more peace of mind from understanding some of these results metaphorically, as well as kind of comparing the two sequences that are looked at. And so this also, there's a lot of positive feedback from the families who underwent these experiences, and they really liked it. They wanted more copies that were in Spanish, and we do have those that are also in the back. So finally, this is something that we're currently working on, and this is a decision tool for sickle cell disease. So there's a lot of advancements for sickle cell disease, and families need a way to understand the different consequences of each decision and how best to make a decision that could affect their entire life. So to do that, we made this decision tool. And one thing I want to point out is that a lot of these are not comic books. So we're using comics, but making them into these online web-based decision tools because there's just a lot more utility to them, and you'll see why once I go through this. So in this story, there's a girl named Mia who's seeing her hematologist, and they talk about these 4 different treatment options, whether it's medications, chronic transfusions, bone marrow transplant, or this newer gene therapy. So rather than run through each decision as a separate thing, we decided to make a comic where we ran through all of them simultaneously. So basically, it was, the concept was that we would show Mia go through each decision and follow her through her entire life into adulthood. And so you could click on any part of her life and a decision, and it would have these different options that you could follow, as well as kind of knowing more about what does that mean for the person in the story, what does that mean for you as the reader logistically, and then why is this happening, where's the science behind it. So this is kind of what the timeline looks like, and I'm going to show you a video that explains how this works. Okay, so this is the timeline that the user would kind of start with. And you can click on any moment here and expand into the story. So the user has the complete ability to read this any way they want. They can read it linearly from one decision for their whole life. They can say, okay, let's check in at 6 months, what's going on with each of these decisions, how is it affecting me? And as you can see, there are differences. So for example, some treatments have a lot of workup in the beginning that can be, with side effects, but then once that is done, there is nothing, that basically the patient's more or less symptom-free for many years. Or you may do something where there's less side effects, but you're having to do something every day for years and years and years. So this is a way of visualizing that, but also by giving the user a way to kind of review it, read it multiple ways. And with something like this, we don't expect someone to read it once, but this would be something they come back to a lot. So then here we have kind of this legend that has an abstraction of these different therapies, so that when you look at it from a bird's eye view, you can say, okay, which ones are where I need transfusions, or which ones are where I go to the hospital. So it's just a guide so that you can not get lost also when you're going through the map. And so then if we can pick a date, just like a random one, I can show you a little bit how the individual page works. So once again, it's like you're in the story, you can navigate through the story sequentially here. But then also if you want to know about, okay, what does this actually mean if I have to go to the hospital? And it goes through at that moment what would that involve. But then for me, it's always important to explain to a kid and a family, why is this happening? And so this goes into the science of it. So you understand, like, this is all happening for these reasons. And then that's basically it. So anyway, it's work in progress, but that's kind of where we're at right now.
Thank you, Alex. Next we have Ethan.
All right, thanks for the earlier introduction. As Alex and Gary said, my name is Nathan Bray. I actually changed my title at the last minute, so I thought drawing fire sounded cooler than whatever I wrote first. Objectives for this talk. So I want to introduce myself and talk just a little bit about the specialty of palliative care, which sometimes even doctors don't know a whole lot about. I want to discuss powerful uses of comics in palliative care, and lastly discuss some of the potential perils of comics in the context of serious illness. So I do work at Johns Hopkins. In my clinical capacity, I see patients in our cancer center as well as in the hospital. I wear two hats as I describe to patients. One of those hats is helping with symptoms related to cancer or cancer treatments, so pain, nausea, shortness of breath, anxiety, stress, insomnia, constipation, you name it. And the other hat that I wear is helping people navigate the complexities of getting cancer care in a modern world, where there are so many different options for care, so many different challenges, particularly when illness gets serious. And in my side life, after hours, I am an artist, cartoonist, and writer, and a full-time imposter. I didn't grow up with comics, and so this is my very first Comic Con. And so to be in this world, I feel like a poser in some ways. And like I don't deserve to claim the title of artist, no matter how many places I get something published. I will still always feel like I don't quite belong here. So I appreciate everybody being so welcoming. So powerful uses of comics in palliative care. Sometimes when I tell people that I make comics about palliative care, they have the bias of comics as being something that has to be funny. And they're like, that seems a little weird. And I love explaining that comics can be a really powerful tool for education, for my colleagues, for people who are coming up through medical school or residency. It can be a really great way to advocate about topics that might seem a little bit difficult to access. And I'm also able to highlight issues and controversies that swirl around related to my specialty. And lastly, it's a great way for coping, both for me personally and at times a way for patients to cope. So for education, so I make comics in a few different formats. I use some of these just simple 4-panel comics for Instagram and Twitter or X. But I use these comics to put out there a hook about something that I see in daily practice. Many times doctors, palliative care is definitely not all about death and dying, but we do see patients who are near the end of their lives. And doctors sometimes have a hard time naming that. We might say a patient's prognosis is grim or poor or limited. And what we're saying, and I made this little baby grim reaper there, is that we're worried someone might be dying. And this is a great visual book. I had people ask me if they could get it on a mug or a t-shirt or something, so again, it works. And it's memorable. So even this uncomfortable topic of death becomes a little more accessible. So I share my work online. I also use it when I'm giving academic lectures, or even sometimes when something comes up on the medical wards and I'm like, ooh, I wish you hadn't said it that way. Here, let me show you a comic that'll stick in your mind. Here's another example of a 4-panel comic. This is just talking about the baggage that comes along with symptoms, particularly in the context of serious illness. So a patient with pain doesn't just have pain, they have stress about pain. So when they tell me they're hurting, they also say, I'm worried that the pain means my cancer is getting worse. I'm worried that means the treatment's not working. So when you treat the pain, it's more than just about a pill. It's also about unpacking that, what I call symptom baggage that comes along. One more 4-panel example. This is what I call Empathy 101, the throw pillow rule of thumb. Everybody has things that people have said to them trying to be sympathetic in a tough moment. Oftentimes those things aren't helpful, and what I tell residents is if something that you're about to say to a patient who's hurting would look good on a throw pillow, don't say it to someone who's hurting. Just count your blessings, relax, everything will be okay. Everything happens for a reason. Come on, happiness is not by chance but by choice. Those things look great on a pillow, but they don't feel great when you're hurting. So silence is better, or wow, thank you for telling me that. Thank you for sharing. During COVID, I paired with a group that does serious illness communication to do some comics about communicating with patients who had cancer, or had COVID. We had this brand new diagnosis. There was a lot of fear, a lot of uncertainty, and we gave language tools in comic format to help not only clinicians cope, but also to help them communicate. Annika, in a few minutes, will talk about some of the awesome things about CPR out in the field. In my job in palliative care, sometimes I see some of the limitations of CPR in the hospital. And so I made this comic a few years back to talk about some of the limitations and controversies about CPR in the context of someone with very serious illness. Comics are a great way to educate empathy. So what I love about comics is that they teach us to read the room. So when you read a comic, you look not only at the text, but at the pictures, at the expressions of people's faces, at how people are arranged in the room. And that's a useful skill for a doctor trying to cultivate empathy and trying to communicate in a way that's effective. I always tell people, be on the lookout for the angry family member in the corner who is not saying a word, but is very frustrated with the plan that's playing out. And if you don't notice that emotion and tap into it, you're going to get railroaded at some point. And they're a wonderful mirror. So comics, for good and bad, can be hard to look at as a doctor. So when a patient has written a narrative about their experience, sometimes it makes you cringe or makes you laugh or makes you cry the way that we can be perceived as doctors, and it's a great way to cultivate self-awareness. And again, I would say comics research is sort of not in its infancy anymore, but sort of in its adolescence, but there are some research projects out there looking at this ability to cultivate empathy in medical trainees. M.K. Sturwick and Laura Ronan did this project where they had neurology residents read patient illness narratives, and they spent time looking at these stories, and at the end they found that residents, they said they were better able to recognize new symptoms, better able to articulate patient needs, and also express increased empathy for those patients. I've also used comics for advocacy, so I talk about challenges and controversies in my field. This came from an LA Times comic about the rise of for-profit hospice care and the way that for-profit industry is changing care for patients at the end of life. And comics have connected me in a broader way with my field across the country. People know me because there aren't that many comics makers in palliative care. So when I go places, people are like, oh, you're the guy who makes the comics. So it's been a lot of fun. Academically as well. Other topics I've tackled are challenges with living wills, lack of resources for home caregiving in our country, the financial toxicity that comes along with cancer treatment, some of the trials of hospital isolation policies during COVID, and many others. And lastly, for me, it's a wonderful space to process things that I see. Things that I see in the hospital can be heavy at times. There is a lot of suffering, a lot of illness, and it's a space where I can unpack some of that, either publicly or privately, depending on the nature of what I'm unpacking. During COVID, again, when the world was shut out from the hospital, it was a way for me to communicate with the public about what I was seeing in hospital walls. And we do have some research to say that comics can be a useful tool for that, for sharing stressful experiences. This was a study where they took medical trainees and had them use a comic to depict a stressful event. Nearly 1 in 5 actually shared an event that they'd never talked about before, so used a comic, and in that format felt liberated to share something that felt uncomfortable. And sometimes my comics are just silly and they're an outlet for me to just let off some steam. I took medical comics or medical terms and brought them to life. So there's a thyroid storm, there's what doctors call a solitary pulmonary nodule, all by myself reading there. The poor pancreas over there. But by far, to me, the saddest, you have a superior vena cava in the top part of your body, you also have an inferior vena cava over there. It's so sad. Imagine going through your whole life in a barrier. So when I present about comics, one of the biggest questions I get is, do you present or prescribe comics to your patients? Do you ever show patients your comics when you're caring for them? And the answer is no, and I want to talk a little bit about why, or perhaps the answer is not no, but not yet. 3 things that really give me pause before jumping into the exam room with a comic are fears about spotlight shifting, lack of evidence, and also narrative confrontation. So we'll talk about what I mean by each of those. Spotlight shifting. So bedside palliative care is about finding patients in an extremely vulnerable moment. So patients are frightened, and the focus is on their illness, their story. If I bring in my comic, all of a sudden it becomes about my story. Also, there's not a lot of time when you see your doctor, and if I take up 5 or 10 minutes of their time talking about my little hobby of making comics, again, I know that it's more than a hobby, but I know that steals time from talking about their pain, their nausea, or whatever it was they wanted to address that day. Sometimes people do find me online before the clinic visit, and if they've found me and want to talk about it, I'm always more than happy. So far, all the feedback's been positive, and people have been interested. Well, people ask, well, could you show them a graphic illness narrative? How about a story about another patient who has cancer? And I think there may one day be value in that, but I think we need more information. We need high-quality studies. What is the impact of looking at someone else's story? To be reminded of your own, what is that going to do to you? What's it going to do to your stress levels? Especially if a patient presents all the stories or all the chapters of their story from start to finish, and your story looks different. In the same way, I wouldn't introduce a new powerful drug to a patient without some sense of whether that new drug is helpful or harmful. So narrative confrontation, each patient has a story that is all their own. But I do see a lot of patients who deal with death and dying. And because of that, not everybody is ready to read a comic that might include death and dying. Also, there's not a lot of authors who have been through death to write about that. So each patient, in many ways, is on their own to write that story. Someone else's third-person story may take them further along in a narrative than they're ready to go. So by way of sort of highlighting some of the challenges, this case study is from the Netherlands, a group consisting of Micah Hahn, who's a PhD candidate, as well as 2 cartoonists, took caregiver stories and translated the research of those caregiver stories into a 230-page graphic novel. They presented this comic to health professionals and found that it was great for raising awareness and stimulating conversation, but they also found that it was potentially harmful due to its emotional impact. Some caregivers were not ready to look at this story. They found that at times it was too confrontational or directive. And I love this quote from their study. So its display of deterioration and death was reported as potentially too confronting for current caregivers, especially when already overburdened. Some caregivers reported feeling miserable after reading the book, or even appalled by the black and whiteness of one of the storylines. So there is a lot of power in comics, and also some peril. So what do we do about that? I'm working on this project to actually introduce palliative care to patients. Palliative care, a referral from their oncologist to palliative care can be stressful. Sometimes people are wondering, does this mean my oncologist thinks I'm dying? What is that hospice? Is it the same thing as end-of-life care? And I try to talk my patients down from that ledge when they first meet me, but sometimes that anxiety can actually keep them from even coming into clinic. So I made this comic to be very simple, soft colors, very approachable. It's not as artistic as I sometimes like to draw things. It's supposed to be very engaging, just one step above stick figures. And I really wanted this to be something that we could pilot and test and say, if patients get text versus if they get this comic story, what will that look like? So hopefully a year from now we'll have more data about what that looks like and say what this drug of comics does if we present it in the clinic. So take homes, comics have tremendous potential, but before getting too carried away with the idea that everyone who has cancer or another serious illness should read a comic, I think we need more data and more thoughtfulness. We also need evidence regarding the emotional impact, guidance with best practices for art styles, and sometimes I think the idea of having narratives that are broken into pieces might be helpful so that people can digest one chapter at a time instead of being tempted to skip ahead in that story and see something that frightens them. I want to finish with this quote from author Zadie Smith. The very reason I write is that I might not sleepwalk through my entire life. I feel that way about comics. I feel like comics make me a better doctor, and being a doctor has made me a better comics creator because it's given me so much water to use as I tell stories. We'll take questions at the end, but there's contact info there.
Thank you, Nathan. And Kriota, for 2 minutes, I'll unplug my laptop.
It did that before with someone else. Just a loose connection.
Oh, the angle was. All right, let me. All right. Okay. So I'm going to be explaining my creative challenges and solutions in making my current graphic medicine projects. So you'll see that my slides are rather densely packed. I can't help myself with this kind of thing. And they're also full of text. And I'll be moving through the slideshow without giving you enough time to read everything on the screen. So don't panic, just blame me. It'll be fine. So to illustrate my slides, I'll be showing images from 2 books in progress, as well as also some sketchbook pages on topics. And I was asked by an editor at a publishing company to make a graphic medicine book for adults about surgery, which is an extremely complex topic. Surgery, A Guide in Comics, is a work in progress that has already won an award from the Arthur P. Sloan Foundation for Writing on Science and Technology via the Writers' Room in New York City. Unfortunately, my final draft of the book was dropped after the publishing company was purchased by another publisher. There was so much drama. I'm not going to go into it. Unfortunately, I still have all the rights. Oh, fortunately, not unfortunately. Fortunately, I still have all the rights to the book. I will discuss the challenges of making it and use some of its drafted pages to demonstrate the concerns of communicating with readers about surgical treatments. Muscle Memories, which is a potential title, is a memoir in progress to be published by Fantagraphics Books. The book is inspired by my arts residency at NYU Langone in the Humanistic Medicine Department, where I teach a drawing class called Art and Anatomy to medical students in a cadaver lab. And it's a dream job, by the way. I really love that job. My goal for this book is to make readers understand that expertise in any healthcare area affects practitioners personally as well as professionally. And hopefully this will humanize anatomical studies, healthcare, and art. So first, a biography. I have been a health science educator and massage therapist for over 32 years. I worked at Memorial Sloan Kettering Cancer Center's Integrative Medicine Department from 2012 to 2019. I have been making graphic medicine comics since 2011. I'm also a medical illustrator, an artist in residence for 2 different medical institutions, and I teach graphic medicine and arts. I'm no longer directly active in patient care. However, getting a certificate in bioethics and making graphic medicine was a
significant method for improving my communication skills with my oncology patients. My other arts residency is at the Center to Advance Palliative Care at Mount Sinai in New York City. My project for them is to create a series of comics illustrations for their online continuing medical education and palliative care units. On the right is one of my drawings, and being an artist in residence with CAPSI is really improving my graphic medicine visual narrative skills, so it's definitely making me a better cartoonist. A massage therapist is one of the few practitioners in the clinic or hospital whose touch of the patient may be occasionally painful, but is often relaxing and possibly pleasurable as well as therapeutic. I would continuously touch the patient's body for 15 minutes to an hour to treat their symptoms. This type of clinical, emotional, and physical intimate therapy can sometimes stimulate flashbacks and memories of medical trauma for the patient. It can also increase the patient's trust in the massage therapist. Many of my pre- and post-operative patients have told me about their fears and experiences of surgery, sometimes questioning the validity of their treatment and praising or complaining about their medical teams. Listening to my patients, I recognized some misinformation or naivete about anatomy, surgery, healthcare, and medical culture. These issues seem to be stimulating fear and stress in patients. So regardless of their perspectives, I've always respected their opinions and feelings while responding to their questions. And I'm a patient with a history of 4 major surgeries. The drawing on the left is a self-portrait representing my laparotomy. It's based on a historical image from the 16th century anatomy book. The 2 drawings on the right are of me during my second hip replacement surgery. As a patient, I have informed conversations with my healthcare providers, and I relate to them as people, which softens some of the horrible experiences I've had during medical emergencies and at my hospital stays. So, from my personal and professional perspectives, my combined experiences inspire me to make graphic medicine comics to educate patients about anatomy, treatment choices, and their encounters with medical culture. I think that understanding of these topics can humanize medicine and reduce the fears and stressors that aggravate patients as they suffer from the inescapable trauma of their illness. I want to educate people before they are patients and educate actual patients as well. So I was asked to make surgery a guided comics for the general public as well as for patients. So I observed a pair of fantastic surgeons, Drs. Beth Hockman and Stephen Lee Kahn at New York Presbyterian Hospital. They were both great and very skilled and very considerate of their patients. And with their patients' permissions, I shadowed them on hospital rounds, observed their surgical procedures in operating rooms, and interviewed them about their experiences. Of course, I wore scrubs, or a bodysuit, a cap, and a mask, but I stayed outside of the sterile field in the OR so that I could make sketches and take notes during the procedures. So here's a photo of me in my scrubs, and some sketches I drew in the OR, and some of these sketches will actually end up in my Muscle Memories book. It's difficult to engage with readers before they are in direct need of medical information. While researching surgery, I read the average person in the USA undergoes up to 9 surgeries during their lifetime. Therefore, I think that everyone is statistically in need of this type of knowledge on an intellectual and emotional level. So here are some of my goals as a graphic medicine cartoonist and former healthcare provider. I want to engage people who are patients, caregivers, friends, or loved ones of patients, define and describe surgery, explain the mutual components of pre, peri, and post-operative procedures Things such as anesthesia, sanitization, difference in similarities between open and minimally invasive surgeries, recovery from anesthesia, and managing post-op pain and wound healing, and including the educational facts that I've just mentioned. It also requires more goals, like engaging people with their body's living anatomy, making healthcare culture relatable, and making this information interesting, entertaining, and not frightening, which actually is the big challenge. So I think the combination of these elements humanizes medicine and surgery, facilitating emotional as well as physical healing. And, you know, it can be tricky. So these pages are from muscle memories, and they show how I engage personally with living anatomy. I'm telling the story of my experience automatically anatomizing Iggy Pop while at his concert, then comparing his behavior and what I assume is his functional scoliosis to the behaviors and functional scoliosis of my amputee cats. Given the right context, I try to use humor to engage readers with educational and reflective topics. And with the surgery book, I personalize anatomy using patient characters to actively display the anatomy affected by their pathologies. Because I'm incorporating personalized anatomy into the explanations of surgical procedures, such as this form of brain surgery in the lower right-hand panels, I add some jokes to soften the impact, and hopefully this will work for people. My own engagement with cadaver dissection has been a life-changing experience. I'm showing that those of us involved in these activities take them very personally. The green panel is from a chapter describing how my father prepared me for later dissections by bringing home a bullfrog from his university's biology lab when I was 11 years old. And we used my mother's manicure set for our sharps, which made a scalloped incision, which I didn't like because I wanted it to be straight. The lower left panel shows my first experience in a cadaver lab at the age of 17, and one of the students wanted to uncover a body's face, which really frightened me. The panels on the far right show my enthusiasm for a dissection workshop that I took about 15 years ago. We were all professionals with passionate interest in exploring different areas of the body. And I just really wanted to see articularis genus, which is a small muscle above the knee. It was very exciting. So, and for the surgery book, I have structured a series of comics that show what the patient and the surgeon experience physically and emotionally as they prepare for and participate in the same surgery. All of these drawings I've been showing you on these slides, most of them are just still in draft form, so you can still get the idea. Here are some more bits about the thing. Adding details, so if you look on the left side, adding details makes part of the book interesting and authoritative. And so I have a series of 2-page spreads illustrating and describing how to perform 11 different surgeries in 10 easy steps, which is also part of the joke to soften the information. I use multiple drawings and writing styles, such as narrated comic strips personalizing the experience of surgery, informative diagrams that readers can use for easy reference, simplistic characters incorporating humor, and detailed splash pages for the chapter headings based on my observations in the OR, such as the small panel up above. I also use metaphor to make information more accessible, and you can see that on the right. It's a page I used in the book. And this page begins the explanation and demonstration of procedures that are essential to patient care, because planning surgery actually is like planning a heist. And so, for example, casing the joint represents imaging the body and diagnosis. Talking like a pro refers to the commonality of specific language for all professions. Planning a route of access demonstrates the priority of accessing targeted anatomy with the least amount of damage to the patient. And I'm going to end this presentation with a poop joke. I use humor as a coping mechanism when I'm stressed, and my rationale is that by adding a talking scalpel to Scalpy, a full-panel strip with a harmless joke, after detailed descriptions of procedures and other patient information, humor using the thematic data can reduce any perceived threat of the medical content. And as I said, both books are still in progress, and as I work on them, I consider how to present potentially threatening material and detailed information in a trustworthy, engaging, and educational format. And I owe thanks to the professors, massage therapists, and physicians who have trained me, and to my anatomy, pathology, massage, and graphic medicine students. Plus, I have deep, deep gratitude to all my patients. So, thank you very much.
Annika Mengwall. I'm from Connecticut. I don't have any distinguished degrees, but I did graduate from high school last month. And I'm here because I love comics, obviously, and I'm going to talk about how they have the power to promote action. So a little bit about me. I always wanted to be a doctor, and I got involved in patient care as young as I possibly could, and there were a lot of opportunities in emergency medicine. So while I wasn't in school, I was riding along with ambulances, and I started when I was 15, which is also when I started EMT class. And then I got my license when I was 16 to practice as an EMT, which is also when I got my driver's license. And I was working as a primary care provider at that point on many 911 calls, and all kinds of different patients, all kinds of different situations. By the time I was 17, I was driving the ambulances too, and I continued to run the sirens and help patients get the medical care that they need. When I wasn't on the ambulances, and I was in school mostly, I was always in the art room, and I loved creating art. And I first started to intersect my love for visual art and for medicine in the art room, because I was using it as an outlet for these emotions I was experiencing as a first responder, especially at such a young age. So I was figuring out how visual art and medicine had such powerful ties, especially in emotion. But I switched to comics when I was seeking more than just my own emotional release, and I wanted actual action. So that happened mostly when I became a basic life support instructor for the American Heart Association, which had me most of the time teaching CPR classes to other professionals and to the general public. And as an educator, I was teaching the classes along a prescribed curriculum, and it was thorough, and it taught everybody how to properly handle cardiac arrest. And I really started to emphasize how important it is. For those of you who might not know, cardiac arrest is when the heart stops pumping blood. It's just kind of frozen in place and doing weird things. So your organs aren't getting the blood they need, and they start to organ fail very quickly, and they can have permanent effects on your health. So it takes time for EMS to get there, obviously. We have to drive this bus through traffic. It can never happen really instantly unless they're there. And so lay rescue CPR is necessary if the patient really wants to have a good chance of survival without complications. But still, the AHA estimates that only about 40% of the patients get the life-saving CPR that they need, even when people are trained, they're not really doing CPR. And I had this feeling when I was teaching classes that the students were kind of pumping through the compressions, passing the test, getting their certificate, and they weren't really thinking about building the confidence that you need to really act and do CPR, because it's a scary situation. But it's pretty easy to do. So this is kind of a little comic that I made about where I experienced people not stepping up. It could be many different reasons why. So they're confused, they just freeze up in place, they never saw anything and try to avoid it. They start and then they realize oh, maybe there's somebody else more qualified. They get worried about things they've heard. the bystander effect, they think that somebody else was doing it. And then, yeah, I'm really sure. But yeah, so I still really was realizing that we need people to get involved. And just kind of long quote, but I'll read it. The AHA is realizing this too. And they have put out a research paper that says that current CPR training courses, although they provide the skills to perform CPR, may not be mentally preparing lay rescuers to respond to an out of hospital cardiac arrest, or to the realities of the psychological impact of their action or inaction. And then they said appropriate models for addressing misinformation and instilling the courage required to intervene should be developed. And at this point, I saw like comics can do that, and I can kind of take you through why. So the sequential structure, as Alex talked about, is especially helpful in this educational medium. So here I show like when you give breaths, it breaks it down into the 2 steps. So like because CPR is such a practice procedure, having things established in steps can be very easy for people to review and at their own pace and absorb it. I don't know what happened on the bottom there, sorry about that. But you're supposed to also say that limited text in combination with more images makes it more accessible for regular, like people who have limited medical literacy to understand, and it's also just more fun to look at. It puts things into context. So this is from my little CPR book that I'm working on, where you can see the patient's in a library, and it kind of goes down. It's just a regular librarian there. She's working, and she has an emotional experience, and it's actually put into a real situation rather than just being like, this is CPR, this is how you do it. So it makes things more concrete. It can address confusions without kind of making them as an aside. So in CPR, common confusion, it can be caused with abdominal respirations, which is when the patient like breathes, but it's just a reflex. It's not actual breathing, but somebody might not get CPR. They do this, so it kind of shows how you can debunk things without making it an aside again, like common misconceptions will be. It integrates it. It has space to undermine bias. This is a separate comment, maybe it is from my book, but something, because minority groups, they tend to see that there are concerning disparages in the rate of CPR that they're getting. So this is one I made about women who don't get CPR. So he's underage and advanced under stress. I suppose she may need CPR, and he's thinking about all these people, and saying, oh, the women are so dramatic, that's why she's faking. Or a woman is saying, oh my God, no, I'd rather die than be exposed. Or you're under arrest for touching her when she's saving her life. Her life be damned, you've gone into the fragile frame. Beware of lady parts, see while you still can. So it kind of uses humor and sarcasm to debunk why somebody might not get CPR. So I've written the comic, and at this point, I did some focus group testing, and I decided to have these medical panels on the side that had more information, but the main feedback I got was like, no one's reading those. People like comics, which is kind of like the best feedback I could have gotten. So I'm trying to work now on getting all that information, really turning it all to comics and not having the regular link writing on the side. And I also want to share the work, hopefully through some kind of accredited medical organization that can include it in their training as another medium for people to learn CPR, along with all the other physical demonstration, book they provide, and video. They can also just get a comic. In the meantime, I also have been working on this another comic project with a team of pediatric ENTs who are trying to promote HPV vaccination. And most people, of course, don't expect to talk about STIs when they go and visit their pediatric throat surgeon. So the team put together this handout that's on the side to kind of simplify the discussion that they're having, that they saw room for improvement. So we brought comics in, and we created kind of not traditional comic book. We have these format with a handout and a poster to inject comics into their practice. So I thought I would just kind of take you through one side. So it's folded in 4, but this is kind of one side handout so you can see ways it might work. So HPV affects the throat. Mine now, the throat. And it says the fact HPV is associated with throat cancer in any individual as well as cervical cancer in females. And HPV affects reproductive organs, most notably the cervix in females. So here you can see the otolaryngologists are pretty concerned with talking about cervixes. So kind of having it as a character makes it a little less awkward to discuss STIs. It might reduce discomfort. The other, here you can see HPV kind of going through all these people, your doctor, friend, parent, niece, son, neighbor, teacher, boss. And so nearly everybody, 70-90% of individuals have been or will be exposed to HPV, including you. The third fact, individuals infected with HPV may not know they ever had an infection, they infect others. So, hello, what's your name? It's not HPV, I swear. You may never know my name. And this kind of implies that HPV often doesn't have symptoms, or it can become undetectable over time. So people just have it and they think they're fine, and so decades later they have cancer. So in comes the HPV vaccine filing. And the fourth fact is that HPV can prevent, the vaccine can prevent throat cancer, everybody, cervical cancer in females, and the infection itself. So here it's preventing HPV infection, keeping the cervix safe, and protecting the throat. So they're kind of being superhero characters too that make the idea of the shot a little less scary for kids. And ultimately, I think what's important is that the patient has autonomy over their decision. They're getting this comic and they're able to think about it on their own and get all the medical information in kind of an easy way. Without ever being ordered to get the vaccines, they can make their own decision while still being informed. The other thing I noticed when I was doing this that I think is not necessarily talked about very much is the opportunity for lettering in comics and kind of the ways that can help make things a little less awkward. So I kind of tried to copy the Yale Medicine font to make it seem more legit. And also I wrote intimate relations in cursive to kind of get the point across without having to spell out SEX, which is preferable in a handout, especially in pediatric offices. And also we see that it can promote interest. So just having that regular old handout before is not quite as fun as if you're sitting in the waiting room and there's tactile interest in it being a folded fun piece of paper you can take with you, and it just has all these pictures and comics. It's fun to look at. So yeah, it's not a traditional comic format, but it still has all the components of the comic, and it might even have the power to help prevent cancer, which is pretty cool. So yeah, that's kind of it, but I'd like to use comics in healthcare to inspire action, and we're definitely seeing a growing number of comics in medical literature, but I hope to continue seeing more and more, and I hope to also continue to do research on their efficacy once I kind of create my own comics too. And that's kind of it. So comics, they definitely, they have so many unique abilities to communicate in healthcare, and I think that we all see they can be especially beneficial in many ways. They're emotionally complicated things that other doctors struggle with, and if they can inspire action, they can save lives. And I think that we can all agree that that is the ultimate superpower. So, thank you.
So many stories left to tell, even if we have to ourselves. Can't keep history on the shelf. If they won't tell it, we will.
If this the land of the free, it was a freedom then, when they annexed Hawaii and called it Cedar Lands, without any type of payment and no signing off. Called themselves a republic in 1894. 1.2 million acres overtaken from the native Hawaiians. When they resisted, the West retaliated in violence and erasure. The Hawaiian language is banned as part of colonialism's plan to expand, yeah.
Stuck between a rock and a hard place. Multiple bombings of Kaho'olawe as a part of their ongoing war with Asia. Used it as a place for target practice. No consent or compensation. Colonizers call for annexation. No regard for all the locals. School will never let you know. So many stories left to tell, even if we have to ourselves. Can't keep history on the shelf. If they won't tell it, we will. Too many stories left to tell, even if we have to ourselves. Can't keep history on the shelf. If they won't tell it, we will. We will.
So if we put Hawaii into perspective, well, Black and Asian history is interconnected. Considering the fight with the Pacific, then of course versus Asia, they was treated as a middleman for war, but didn't let the Western colorism run its course. Cause dark skin was a sign of dignity to core. The land was taken in the name of capitalism, when prior to it was an actual kingdom. Clap back at the system.
Stuck between a rock and a hard place. Multiple bombings of Kaho'olawe as a part of their ongoing war with Asia. Used it as a place for target practice. No consent or compensation. Colonizers call for annexation. Network out for all the locals. School will never let you know. So many stories left to tell. Even if we have to ourselves, can keep history on the shelf. If we won't tell it, we will. Too many stories left to tell. Even if we have to ourselves, can keep history on the shelf. If we won't tell it, we will. So many stories left to tell. Even if we have to ourselves, can keep history on the shelf. If we won't tell it, we will. Too many stories left to tell. Even if we have to ourselves, can keep history on the shelf. If we won't tell it, we will. We will.